Hello! So my name is Navia. So one of two things, either you don't know who I am because you're a new subscriber, or you forgot who I am because I haven't made a video in a long time. And yeah, so I wanted to start off by saying hello. Sorry I haven't put anything. Life update. I have graduated, so yay! But my state is on quarantine, so I have not been able to sit down to take my board exam, so I'm not licensed. Yeah, so I'm kind of in this weird limbo state of like graduated, not employed or licensed, and that's okay, I guess. It gives me the allowance to do these videos for you guys, try to help out students who are probably at home trying to study or trying to get ahead, and it helps me review for my board exam, I guess, a little bit in a way. So I'm just going to be studying, and if I find a topic I want to talk about, I'll probably bring it here. Today I'm going to talk about oxygen and basically delivery devices, interfaces, whatever you want to call them. And I'm going to show you like the most common ones and just talk about it a little bit. So let's just get into it. First, I wanted to say, if you are a new respiratory student, the first thing you need to know is the difference between an oxygenation issue and a ventilatory issue. Basically, for oxygen, you're looking at your PaO2 or your saturation, and for your ventilation issue, you're looking at your CO2. So I wanted to start off by saying, if you have a high CO2 in someone, none of these devices are going to really help. This is just for oxygenating people. If someone has a ventilatory problem, they're going to need a ventilator. Ventilator, get it? Yeah. With that said, a lot of people say you can't fix a ventilatory issue with oxygen, but in a way you can. If someone comes into the hospital and they're breathing with a high respiratory rate, they're, trying to struggle to pull in oxygen, if you give them oxygen in one of these devices, in theory, and you're going to see it when you actually see a patient like that, you're going to see that when you give them the oxygen, their breathing will slow down because they're meeting their demand that the body wants. So they're going to start slowing down their breathing. So in that sense, I don't like that rule of oxygen can't fix a ventilatory problem when it can, kind of. Anyway, with that said, I'm going to show you guys some different devices and stuff like that. So the most common thing you're going to see in a hospital setting is a nasal cannula. I'm not sure if you can see that very well. So usually I would see this on like 1 or 2 liters when patients would come in and they would say, they're experiencing dyspnea and like they're just having a little bit of issues, but they look stable. They would get this. So I just wanted to show how to put it on real quick. So I'm not sure if you can tell, but you want the prongs. You don't want the prongs up like this because they'll stretch their nares, and the oxygen will just hit the wall of their nose. So you want them down, and you're going to put them in around their ears. Make sure it's in there, and then, tighten it up. Make sure the patient doesn't, take it out for whatever reason. That happens. So usually 1 or 2 liters, they'll put them on until like they can test them and see what their PaO2 is and see if they need more support. You kind of see people who, have COPD with it sometimes, who are they just need that little bit of support. Anyone who needs just a little bit of support, this is usually what they get. Above 4 liters, you get humidification with it. But yeah, I don't really see it more than like 1 or 2 liters, unless like they're weaning, which, I'm just saying what I've seen. I'm not saying that they're never above like 2 liters, but it's just what I've seen. It's usually 1 or 2. The next device that I've never actually really seen this in the hospital, to be honest, unless I saw it like one time with like an older lady, is a simple mask. It gives a little bit more liters per minute in FiO2 than nasal cannula, but I don't see it that often, so I'm not going to remark on that, but just wanted to show you. Simple mask. And then the next one, like I said, the nasal cannula is the most commonly used. This one is the next. This is called a non-rebreather mask. It has a bag on it. This little reservoir, when you have it on a patient, you need to make sure it's fully inflated, and when they breathe in, that it does not collapse. You want to make sure it's always inflated. So this is probably the next common thing that I see in an emergency room or in a hospital setting, when patients are not stable and they need a high FiO2. This almost gives 100%. A lot of people have a debate whether it's a high flow or if it's like low flow. In my book, it says it's low, but in the same book, the definition of a high flow is meeting or exceeding someone's inspiratory demand. So in my opinion, I think it's a high flow. So yeah, I see this on the most, like, more critical patients get this, less critical patients get a nasal cannula. These are the two most common in like the ER, or even like in ambulances, they'll have one or the other. You don't really see other masks. The next mask I want to show you, so for people with COPD, they usually could have a hypoxic drive. So if you hear someone talking about someone having a hypoxic drive or being part of the 50-50 club, basically what that is someone who their normal oxygen levels are kind of lower than usual people and their CO2 is a little higher. So for those patients, you want to be careful and you don't want to give them too much oxygen because you're going to put their body through shock. And when you do that, they might end up, dozing off, falling asleep. That'll be their first sign. You don't want to put their body through anything harmful, so you want to make sure that, you don't overdo it. And this next mask helps with that. You're going to see this on board exams, mock clin sims, and it's called a Venturi mask or an air entrainment. So let me kind of show you guys. So right here, you're going to see the liters per minute and the FiO2, and here you're going to see the air entrainment. See, with the higher oxygen, it's a smaller port, but if I go up, it increases the amount of air entrained, and the oxygen level, the FiO2, goes down, and the liters per minute go down. So you're getting oxygen, and then you're getting your air entrainment. And you can lock it in so it doesn't move around, see? And then they have this little cool cup to make sure that, when a patient is laying on their bed, that no sheet goes in there and increases the oxygen. This gives a precise FiO2, so again, for COPD patients, it's pretty ideal. I would say, in my personal opinion, I'd rather have this, especially for like a board exam. If they give you this option, I would probably do it, but then again, you do have to consider their actual oxygenation, and you have to, do the equations and figure out what their need is, because if they're giving them a weird FiO2, like, don't use it, obviously. So kind of figure it out, but if you have like a choice between that and something else with like the same FiO2 range that they need, I would kind of go with that one because you're more precise and you know. The other ones are kind of like estimates and guessing. So I do see that sometimes, but not that often in like real clinical settings. Okay, so what I do see a lot is this. This mask is an aerosol mask. It's designed for breathing treatment, so you would plug in. I don't have the stuff for one, but you would plug in the breathing treatment here and have the patient just chill with the mask. Usually this is for like elderly patients or people who are not compliant with holding their breathing treatment with the handheld. So another thing I have to say about this is that if you see that they can't really do it with the, I don't really have one, but I have a piece of tubing for some reason. If you see that they're not getting that little breakage in the mist in their breathing treatment, I would recommend doing a mask, or I would recommend giving them nasal clips, not dropping them because it would gross them out. But yeah, just giving them some clips to get the little breakage and make sure they're breathing through their mouth. But if you still don't see that, I would definitely do a mask. If they're trying to like act cool and be on their phone and use it like if it was a cigarette or something, no. I would be like, could you put your phone away, or do you want me to come back later, like in 10 minutes when you're done with your phone call? Because you want to be respectful, but at the same time, you want them to take it serious. This is medication, and if they're not taking it, they're wasting the medication, one, and two, they're not getting better. So why not do it right the first time? I don't know. If they can, always try to do the handheld. It's just more effective. What else can I say? I think that's it for now. That's all the devices I have to share. If you have any questions or comments, leave it below. I do want to know your opinion on the non-rebreather mask. If you think like it is a high flow system or not. Leave down below if you have any comments on videos you want to see. I think the next video I might talk about ABGs a little bit, and or maybe ventilators. No, I'll probably talk about ABGs because it goes kind of hand in hand with this video, and you guys would understand things a little bit more. So let me know. I might also want to do diseases maybe, because I'm studying right now and I don't know, it might help. So let me know what you want to know. Okay, bye.